the simplest answer is because it's what I do. And the qualified as this is just I'm passionate about everything in my life. So if I do something, I want to do it as best it can be done. That's just how I do things. I do it right or I don't do it. So there's a part of that I think that ultimately that's the real reason. But I don't know. I think you get in the details and really, 26 years in practice, it's about the patient attached to the dentistry. So it's much more about that person, making sure that person is happy, make sure they're better off, make sure they get what they wanted, and make sure I'm professional, make sure it's the best option for that person. But yeah, it's probably that simple, to be honest. It's really not as complicated as you might think.
What about the community? What is it about the community that draws your attention to, want to help them?
They're great people. I'm telling you right now. It's just I've met some wonderful, wonderful people since I've been in practice, and a lot of them I would consider lifelong friends. I have patients who I don't see for 15 years, and they walk through the door, and I remember them like it was yesterday. So they're just really good people in Virginia, and all around the world for that matter, but definitely in Virginia for sure.
What are some of the things you enjoy doing on your day-to-day basis when you're not doing dentistry?
Well, I have a lot of hobbies, but probably on any given day, I spend a lot of time with my dogs. We do on walks. We play some, play guitar. Music is just a big part of it. Movies. I love movies. I love stories. I love culture. I just love learning new things every day. That's really probably a good day for me is to learn something new.
How do you merge the passion for arts in dentistry, like for your passion for dentistry?
Well, there's a vision, or maybe it's just how I think about things. I see things very visually in my head about how things should be or how things are. So that three-dimensional or spatial awareness, I think that's a lot of who I am. I can see things for what it is, and I can see for things what they should be or will be. And I think that vision is a lot of it, especially for implants when someone wants to rebuild their smile, or just a lot of things. It's just more about seeing it. Surgery is about doing stuff for the patient and knowing how it's going to turn out weeks or months later. Dentistry is a form of art, and I feel like that's for those of us who participate in it, we know that. Our patients know it, for that matter, too. Okay, so I would to tell you about my sneakers. This is probably my favorite pair. These are the reverse Papa Bears. Probably my favorite, for sure. The Phillies. So
they say, you're quite the stylish man, and you're a huge sneakerhead. What's that all about?
Well, I've always liked style and design as an adult, even as a teenager. And the sneakerhead of me is kind of a newer thing, but I think it reminds me of my youth. I think about those when those shoes came out when I was younger and how much I liked those. And even now, I like it more because there's a certain nostalgia to it, I guess, but still, there's a little art to it. It's just fun to say, why do I like that one pair of shoes compared to another? And I don't have a good explanation other than just, I do. I can have a conversation with almost anybody. I really enjoy just meeting people. And there's always this commonality I can find. It's always something very fascinating. And I'll find a perspective they have that they want to share with me. Or if I have one, I'll share that with them as well. But it's really that's much more of that bond that you create. And really, it's kind of, I always say that oral surgery, you got to be kind of fast friends with everyone because they're nervous and you want to talk about something that they feel comfortable talking about. So you can usually find something on every single person. And I think the patients who come to see us, to me, that's what I hope they would see. Is okay, yeah, wow, what an interesting conversation. And oh, by the way, I got my dental work done.
What is it that you want to be known for in terms of as a both dentist and your overall practice?
Well, for me, I want to be known for, how I treat my patients, how much they enjoy seeing us and letting us perform surgery. I want to be known for doing really good treatment planning, good work on our patients, and getting good outcomes, and stand behind our work. Make sure they know that, hey, we're doing this and it's going to last. But that's probably the main thing. Oh, hang on just a second. Oh, it's a patient. Hang on, excuse me just a second. Hello? Oh. Hey, what's up? No one's at the office right now. Do you need something? Okay. All right, hang on a second. Guys, do we got everything? Because I think I might need to go see a patient.
Yeah.
Okay, is that all right? Okay.
Yeah, that's fine.
Okay, all right, guys. I appreciate it. Thank you. All right, I'm back. Okay, I think I can meet you there.